Sean, thank you. Arthritis. We've all heard of it. Many of us have it, yet we may not understand it. What is there to know, and how do you treat this chronic disease that can negatively affect your quality of life? Here to talk about it is Shannon Bofelli with University Orthopedics and Spine. Good morning, Shannon. How are you?
Hi, good morning. Great.
You are a nurse practitioner over at Orthopedics. Yes. Great to have you. Let's talk about arthritis. This time of year, it's a big topic of conversation.
It really is. With the cold weather and with the storms coming in and out in the Vegas Valley right now, we always see a pretty big increase in the amount of people that are having arthritis pain. And that's usually brought on just by the changes in the weather and the cold temperatures.
Certainly. And when it comes to arthritis, you and I were talking about it, there are a lot of misnomers. There's a lot of false information out there. So what are some of the basic facts that you feel people can embrace?
There definitely is. People need to know that arthritis is, unfortunately, just a natural degenerative process of your joints that causes the cartilage in the joints to slowly degrade over time. The risk factors are people over 55, people that unfortunately have a genetic predisposition to it, meaning if your mom or your dad had arthritis, then there's an increased chance that you're going to as well, and it may be a problem in the future.
Wow, that's interesting because my mom has been mentioning her arthritis in her thumb to me lately, so that might be an indication that's something I will encounter. Yeah, is it?
It is.
It's popular in the thumb. All right, so we understand some of the facts about it. What about the treatment? What options are available out there?
So the treatments, you want to start off with non-operative treatments, meaning some of the basic therapies that you can look into are medications like anti-inflammatories, Tylenol. You can try heat and ice compresses. Bracing is always an option.
Yep.
And then
you see a lot of that.
Yeah, definitely.
Yes.
A big thing that people miss sometimes is that you really want to work on strength preservation, meaning working out in the pool, doing some biking, things like that, to try and help keep your muscles strong, because that will help prolong the life of your joints.
That's right, and I believe the last time you folks were on the show, you were talking about how important it is to keep active, to stretch, to keep activity in those joints and muscles.
It is.
Right?
It is. The human body is really designed to be active all the time. And the more stationary you are, then the more stress you're putting on your joints, because your body just doesn't like it.
Interesting. Can we go back just a minute, because I think that some people may feel they have arthritis. Maybe they're kind of putting off going in to get treatment.
Sure.
Let's talk about how people can identify the symptoms of arthritis versus other things that might be going on.
Yeah. So it can be difficult. It's easy to confuse arthritis pain with some other kinds of pain, but usually stiffness of the joints, joint inflammation, limited range of motion, and then when it starts to get pretty progressed, you can see changes in your actual limb alignment. So you may notice that your knees, you're starting to get more knock-kneed or more bow-legged, and that's usually an indication that you have some pretty progressed arthritis in your knees or hips.
Gosh, I tell you, it's just no fun.
No, it really isn't.
It is no fun. The great thing is, over at University Orthopedics, you have 5 great physicians that you work with. You are a nurse practitioner yourself. This is a growing field, actually.
It really is. The medical field in general is moving more and more towards what we call mid-level providers, so physician assistants and nurse practitioners, to fill in a lot of those gaps in coverage. I obviously work in a specialty field, but mid-levels have been used a lot recently in primary care settings because it's becoming harder to find physicians that are filling those roles. So mid-levels have really stepped in and become very valuable.
It's great. No, it's great that nurse practitioners are being more valued and utilized as well. And I wanted to note, it's interesting your name is University Orthopedics, because actually several of the physicians in your office teach at UNLV.
Yeah, absolutely. So it's a big part of our program. All of the surgeons that work there also work with our residents and work in education at UNLV.
Well, it's a great bunch of folks you work with over there.
They are.
Yeah. By the way, where are you located if people want to visit you?
Our office is on the corner of Oakey and Decatur Boulevard. And then we do most of our surgeries at University Medical Center.
Shannon, thank you so much.
You're welcome.
Great talking to you. Take control of your aching joints with the help of University Orthopedics and Spine. They're located on West Oakey and Decatur. To learn more, call the number or visit the website on your screen. University Orthopedics and Spine is a proud sponsor of the Morning Blend.